So I'd like to call this meeting to order. I'd like to acknowledge that we're doing this meeting from the traditional territory of the Lakota people. Can I get a motion to adopt the public agenda, please? We need to use our mics. Can I get a seconder, please? Second. Thank you. Moving on, we do have a delegation this afternoon. Sorry. Calling the question, all in favor of the public agenda? Seeing no opposition, that carries. Thank you. We do have a delegation this afternoon, so I'll turn it over to Stephanie.
Thank you. A couple apologies before I get started. One is that I was out all Thanksgiving weekend with a bit of a cold, and I'm on the tail end of that now, but if I need a personal moment, I'll apologize in advance. And also to Director Kerr and Dahl, some of this will be a repeat of what you guys are going to see at the Committee of the Whole, but I have adjusted some of the content just to spice it up a little for you guys. So... Doesn't seem to be working. Thank you. That's perfect. So a bit of an overview of the Strathcona Housing Alliance and the most recent point in time count results. So the Strathcona Housing Alliance was built out of the former Campbell River and District Coalition to End Homelessness after completing strategic planning and realizing that some adjustments needed to be made to better reflect changing regional dynamics. The former coalition was never a registered nonprofit, but simply a grassroots network, and was formed out of the Strathcona Community Health Network in 2018. The new alliance is a registered nonprofit society. At the Alliance, we have a volunteer board of directors, currently including a number of people interested in housing and homelessness. Madison Stewart, Mike Johnstone with Naturally Pacific Resort, Tyler Feinstadt with the John Howard Society, Christy Schwaneke with Vancouver Island Mental Health Society, Rachel Weaver with River City Inclusion, and Carmela Rees is a community member with lived experience of homelessness. Next slide, thank you. Our work looks to do 6 things. First, we'd like to understand housing needs throughout the region. We look to have a priority focus on those with the highest needs. Second, we encourage collaboration to prevent and respond to homelessness and promote housing security to ensure efficiency and to incorporate community-led held knowledge. Third, we convene and facilitate meetings to promote partnerships related to housing. Fourth, we connect sectors to share information that advances individual and community safety and well-being through appropriate housing and supports. Fifth, we are a resource of data and information related to housing and homelessness. And sixth, we identify and advocate for systemic changes that address the root causes of homelessness and housing insecurity. Next slide, please. Thank you. As a new organization, we have been undertaking organizational startup for the past 9 months. This has included recruiting and onboarding a board of directors, creating policies, and identifying key projects to help ensure that we are doing what we say we will do. In order to diversify our funding, in 2025, we have undertaken a number of fee-for-service projects, including supporting the John Howard Society of the North Island by creating a youth housing needs report for Campbell River, providing lived experience engagement for the primary care network to better understand if and how people experiencing homelessness are accessing primary care services and how they could be better served, and undertaking the 2025 point-in-time homeless count, which we do in partnership with the province and the Homelessness Services Association of BC, which I will provide an overview of in a moment. We also have 2 upcoming projects. One is under development, but we do want to take a closer look at how we can create opportunities for community to engage in conversation about housing and homelessness through events, panel discussions, and so on. We're currently considering a possible documentary film series in 2026 with panel discussions to follow. We all know that it's becoming increasingly difficult to find spaces to have policy debates and thoughtful consideration, and find ourselves in a time where policies are often demeaned rather than discussed. And so we're looking for ways to kind of create a better platform for people to be able to come together and discuss challenging topics. And second, in early 2026, we intend to bring a housing symposium event to Campbell River. This event will take a more locally, regionally based look at housing and homelessness, and I will talk briefly about that at the end of my presentation. Thank you. But first, I'd like to present some of the findings of the 2025 point-in-time count. Because this is a Health and Wellness Committee specifically, instead of just a general overview, I'm going to focus in on some of the health and well-being aspects of this year's PIT count. So first of all, PIT counts, for those of you who aren't familiar, are a 24-hour snapshot of homelessness. They are an accepted methodological tool. They're used all over the province. They look at demographics, characteristics, service use, and other information, and it's all collected from people experiencing homelessness. They also show changes over time as communities participate in them regularly in multiple years. So ours was on April 30th of this year, and this was our fourth point-in-time count. We've had one in 2018, 2021, and 2023 previously. It's important to note that point-in-time counts are an undercount. They should be considered to be the minimum amount of people experiencing homelessness. Despite best efforts, we cannot survey everyone in a 24-hour period. They also do tend to undercount certain demographics. Women, youth, and seniors are examples of demographics that tend to have more hidden experiences of homelessness, and so it can be challenging to locate them on the day of the count. As such, we always recommend that people seek complementary data sources, such as reports from local service agencies, to corroborate findings, and this is also work that the Strathcona Housing Alliance engages in. We had over 30 individuals help with outreach surveying on the day and 24 locations that did surveying on site, and these data would not be possible without that support. So if you are familiar with previous PIT counts, you may notice that the results are displayed differently this year. Notably, this year, knowing that Indigenous people tend to be overrepresented in homelessness data, the province worked with the BC Association of Aboriginal Friendship Centres, and for each chart, they have broken it down into all respondents, Indigenous respondents, and non-Indigenous respondents. In this way, we can get a more specific understanding of Indigenous experiences of homelessness. So on April 30th, we identified 174 people, that's the bar on the far right there, who met the definition of homeless for the purposes of the PIT count. In general, that definition is someone who does not have a place to pay rent, and rent is considered a regular monthly payment of money for the ability to stay in a place of your own or shared with roommates for 30 days or longer. For youth under 19, the above definition applies, but only to those youth who do not live with their parents or legal guardians. This definition does not include those who are living in financially unstable tenancies or in unfit or unsafe housing, which of course we know is significant. You'll see in the chart displayed Campbell River's results over the 4 years that we have done point-in-time counts. So starting in 2018, a total of 81, 2021, 116, 2023, 197, and a slight reduction this year at 174. Next slide, please. Thank you. You'll notice that the results are also split into sheltered and unsheltered respondents. So sheltered is defined as staying overnight on the night of the count in homeless shelters, transition houses, safe houses, or temporarily in hospital or jail. It specifically refers to places that are meant for temporary sheltering. It's a little bit confusing because unsheltered means staying outside, staying in a vehicle, or couch surfing. So while some of the people in the unsheltered category were technically sheltered because they were couch surfing, they are considered unsheltered for this count because they were not staying in a designated place for people experiencing homelessness. So of the 125 respondents who were unsheltered, 29% were staying with others, so couch surfing. The remainder were staying in vehicles, camping, or sleeping outside. You'll notice that between 2023 and 2025, we had quite a drop in our sheltered number. This year, I believe that was a blend of factors. So one is that transition house numbers can fluctuate significantly on any given night, particularly if there are not children with their caregivers on the night of the count, and transition houses are for women and their children fleeing violence. Number two, very simply, the weather was nice that day. People might have been choosing to camp instead of stay indoors. Or a more nuanced consideration is that Campbell River does tend to trend fairly high with percentages of seniors, youth, and women experiencing homelessness. It's possible that the community shelter services are not meeting the needs of these populations, and that's why we're not seeing more people access shelter. And by that, what I mean is that there are few options available for youth under 19. Seniors must be able to manage their own mobility and hygiene needs to be eligible for shelter stays at Campbell River's current offerings. And women have few options that are either allowable or feel safe for them, especially with Queesa Place now closed. And Evergreen Shelter only has a few beds for women. In fact, in 2025, 49 people were in the sheltered category and only 6 of those were women. So 43 were men. That means that almost all of the women enumerated this year were in the unsheltered category. Next slide, thank you. So you'll notice at the top of the chart, it says figure 12, gender identity of respondents, and then N equals 154. So this N is new this year. This indicates the number of people who chose to respond to that question. So while we surveyed 174 people in total, only 154 chose to answer this question about gender identity. Of those, 58% were men, 40 women, and 2% indicated a different gender identity. Campbell River tends to have a higher proportion of female respondents than we see provincially. While we don't yet have the full 2025 provincial report, in 2023, 32% of respondents were women provincially, whereas Campbell River was at 40% that year, and I expect it to be similar this year. Interestingly, we can see quite a difference between Indigenous and non-Indigenous this year, significantly more men than women for non-Indigenous respondents, whereas for Indigenous respondents, it was much more of an equal representation. And again, I'll just remind you that women's experiences of homelessness do tend to be more hidden just for safety reasons generally, so it can be a bit more difficult to quantify. Again, this is interesting to look at like trends over time, but we do need to be cautious about any statistical certainty. Next slide, please. 155 people responded to the question about age. 55% of respondents were adults, 25 to 54 years old. 25% of respondents were seniors 55 plus. Sorry, 55% for adults, 25, for seniors, and 19% were youth under 25. Of a total 30 youth respondents, 12 were under the age of 19, which is the age of majority in BC. And of the 39 senior respondents, 12 were 65 to 75 years old. We did not survey anybody over the age of 75. Looking at the bottom of the chart there, I'd just like to take a moment to emphasize how critical it is to address youth homelessness. As you can see at the bottom, almost half of respondents said that the first time they experienced homelessness was when they were youth. So from this and other data across the province, we can see that youth homelessness is actually a significant predictor of adult homelessness. And similarly, almost half of respondents had been in the foster care system as youth. Next slide, please. 148 people responded to the question about Indigenous identity, and 58% of respondents identified as Indigenous. Significant overrepresentation, again, as we've seen in previous years. The most recent census data we have is 2021, where Campbell River has 11% Indigenous population, so this is a significant overrepresentation. The question was broken down further, asking people to identify as either First Nations, Métis, or Inuit. In Campbell River, 82% of respondents identified as First Nations and 18% as Métis. Next slide, please. A bit small, I apologize, but here we can see the services that respondents accessed over the past 12 months. 137 people responded to this question. It was most likely for people to access food services, though I will note that the point-in-time count was done prior to Hama-Alis Community Kitchen closing down, so we don't know what the impact of food security looks like without that service available. Following that, it was most likely for people to have accessed the emergency room, with 61% of respondents indicating that they had visited emergency in the past year. Interestingly, we might expect to see a lower rate of service use amongst Indigenous respondents due to historical harms in the health and service systems. Yet in Campbell River, Indigenous respondents were more likely to access all services listed, which included the emergency room, health clinic, mental health services, food services, as well as cultural services. Again, I don't yet have provincial comparables to see if this was the norm across the province, though I do expect that full report in the next couple of months, and I would be happy to share more with this group at that time. Perfect. There's a strong correlation between experiencing homelessness and having significant health challenges. This correlation is not just one directional. The dynamic between housing and health runs both ways. So people with poorer health are more likely to be unhoused, and also chronic exposure to homelessness can worsen physical and mental health conditions. Health challenges can be a significant barrier to accessing safe and stable housing. What data show is that people experiencing homelessness have significant health issues, and many have co-occurring health issues, such as combined mental health and substance use concerns. This leaves housing providers trying their best and sometimes accepting tenants that are not appropriate for their buildings simply because there is not another option for them. In my professional opinion, housing is healthcare, and we are not building housing that is responding to the significant health needs of the people who need it. An interesting project out of Toronto last year, they built a 48-unit supportive housing building on hospital property in Toronto. Researchers out of Ontario estimated that a month in hospital costs somewhere around $30,000, whereas a month in supportive housing costs around $4,000 a month. And they opened this new housing model in 2024, directly connecting people to housing as well as medical professionals. They selected 48 individuals who had been responsible for 2,000 emergency department visits the year before they moved in, and those were their tenants. Between emergency visits and hospital stays, the 48 patients had been responsible for $2.1 million in hospital costs over 1 year. 1 year after being housed in this new building, hospitals calculated a savings of $1.66 million compared to the year before from only those 48 patients alone. So not only is housing the humane choice, it's also the economical one. For Campbell River, 41% of our respondents to this year's PIT count indicated that they had had a hospital stay in the past year. Many would have had multiple visits. People most commonly cited mental health and substance use concerns here in Campbell River. This was followed by a general medical condition, a disability related to the senses, such as sight or hearing, a learning disability, a physical disability, and then finally a quarter of respondents indicated a brain injury that happened after birth. Next slide, please. This year, respondents were asked which substances they used. 139 people chose to answer that question. When people use substances, it was common that they don't just use one type. So 74% of respondents said they use nicotine, 55% cannabis, 53% alcohol, 43% stimulants, and 31% opiates. 12% indicated no substance use. This is fairly comparable to answers that we're seeing in Vancouver's point-in-time count, which they do separately, and other counts on the island, such as Port Alberni and the Comox Valley. Understanding what substances people are using can help communities understand what services and healthcare may be needed to support people on the road to stable housing and health. Next slide, thank you. So my final slide related to the point-in-time count is about income. This being a health and wellness committee, we all know that poverty can have significant impact on health and wellness. 79% of respondents were on income assistance at the time of the PIT count. This was a mixture of normal income assistance and persons with disability assistance. 9 people had a full or part-time job, and another 15 people had casual employment. An additional 21 people said they had informal employment, and this would often be like honoraria type work. So people who maybe helped in Hama-Alis Community Kitchen for an honoraria, or people who do community garbage pickup with the Moose as part of the Get the Point program, they would have identified as having informal employment. The reason I wanted to touch on income as part of health and wellness is that BC's income assistance shelter rates would not allow for someone to afford a rental in Campbell River, even the most affordable rental. So the shelter portion for income assistance is maxed out at $500 a month for an individual. And of course, we know it would be incredibly challenging to get or hold down a job without having housing that provided access to showers and laundry and the ability to have clean clothes. Most employers would be reluctant to hire someone experiencing homelessness, particularly those who are camping or living in vehicles and so on. And also many people might not even have an address to use for tax purposes or to be able to get appropriate ID, bank accounts, and so on. So when as a society we're not addressing income or rent geared to income housing for people, we're really trapping people in a cycle of homelessness. It would be very difficult to get out of that cycle independently. And rent geared to income refers to tenancy arrangements or program agreements where the person's rent is based on their income. So typically it's either their income assistance shelter portion, or for those who are not on income assistance, it's usually somewhere around 30% of their income. Next slide, please. The PIT count data is available for community use. We invite governments and nonprofits to access this data to help with funding applications, program and housing development, needs assessments, provincial advocacy, and so on. As an example, I was able to share additional information about the 2021 PIT count results with city staff during the conception phase of Homewood, and these data help to show the need for additional units in our community. If there are specific data requests, for example, looking at a certain category by gender or age, I'd be happy to receive and discuss those requests. You may also notice that some of the information I presented today is not available in the public report, so there may be helpful info for organizations that isn't available publicly. So please do reach out and I can see what I can find. Just very briefly, my final slide for today is to touch on the housing symposium that the Strathcona Housing Alliance is planning for winter, spring 2026. This will be an inaugural event, and we hope for it to become an annual event to be built upon each year. The intention is to create a space to do a deeper dive and have further conversations about emerging topics with the goal of encouraging solutions and partnerships in Campbell River and the region. We are currently considering a number of development demographic-specific needs and geographical anomalies that we might like to focus on for this upcoming symposium. Our invite list will include representatives from all levels of government, frontline service providers, managers, healthcare leaders, non-market housing associations, market developers, and more. We anticipate that this will be a one full day event for this year, and we're hoping that we would add another day in subsequent years. I would like to invite this committee to become part of the event by becoming a sponsor of the event, and would love to see you guys be the platinum sponsor, asking for a $5,000 contribution towards our inaugural event. And with that, I will leave off and open it up for questions.
Questions?
Thank you, Chair, and thanks for the report. It's great to see the numbers. Does Island Health, I note here that they tracked Indigenous and non-Indigenous right through it. Does Island Health with the hospital, do they also track emergency room usage and hospital use with Indigenous, non-Indigenous breakdowns?
Dawn, do you know the answer to that question?
So they do have a program that recently started at Island Health, like a self-identification program, but that there was never any consultation in the community or with our local Indigenous partners. And so there's been some sort of, they've requested that program be paused because the Island Health wasn't able to provide what it is they were doing with that information. Mm-hmm. So they were collecting it, but they weren't saying what they were actually using the information for. The idea behind it was to then be able to provide support with the Indigenous liaison nurse that's in the hospital. That's their intention, but it's not how it kind of got rolled out. So I think it's just being paused right now. And then they need to come up with a plan as to how they're going to use that data. So
Okay, That's good, thanks.
Well, I actually got this report yesterday. And something that I had noticed yesterday was where it has the sheltered number at 85 in 2023, then sheltered number at 49 in 2025. And I was struggling to understand how there could be 85 beds that were filled in 2023, but only 49 beds filled in 2025. And the difference there is 36, and the city, in partnership with BC Housing, provided 40 new units at the Homewood Village, which should have meant that there was 40 spots in shelters opened up. Not everybody came from shelters, but quite a number of them did. So I was wondering, how does that work when we open up 40 new units, but the number actually gets worse?
Yes, good question. So you will notice that the overall number did improve, and I do attribute that to the opening of Homewood when we went from 197, is it, in 2023 to now 174 this year. So people who were housed in Homewood would no longer be counted in the point-in-time count because they would be considered housed, so they wouldn't be in that homeless category anymore. I can explain the drop in sheltered and unsheltered. I think the sheltered this year is coming mostly from two locations. So our sheltered locations are jail, hospital, the Ann Elmore Transition House. We count the Rose Bowl because they're funded as a shelter. Evergreen Shelter and Quisa Place. I think we had a blend. This year we had nobody in cells and nobody in the hospital with no fixed address on the night of the point-in-time count. So we didn't have anybody there. We had the transition house was very low vacancy that night, whereas sometimes, as I mentioned, sometimes a woman might come in who has 3 or 4 children, and you might have a few of those in at any given time. It can really bump up that sheltered number. So transition house had really low usage that night. And then also people were choosing not to sleep at Quisa Place that night. That was the last night that Quisa Place was open before they closed down for they're just a seasonal shelter, so before they closed down. So I don't know if people were not staying there because it was good weather that night and they were choosing to camp, or if they were not staying there because they were already making other plans to knowing that the shelter was closing down the next night. So those were where we saw the drops this year.
During your presentation, when you talked about the drop from 197 to 174, you said a small drop. Mm-hmm. And I would suggest that was over 10%. That's a large drop, and I think that a lot of communities would love to be where we are right now, so that should get the recognition that it deserves, because it doesn't come without a lot of work and money.
Yeah, absolutely. And I did acknowledge that in the press release that I did, that, the city and BC Housing and Lookout Housing should, be applauded for opening Homewood, because I don't think we would have seen a drop at all. We would have seen an increase again, is my guess, had that facility not been opened.
And it was a lot of work on your part, too. You were in all of the meetings with us to finally get what we knew we needed. It just took us an extra year to satisfy the provincial government. And we have 8 more units that will be delivered hopefully in the next 3 weeks. All of the underground works have been done, so it should be hooked up quickly. Now, you also said during your presentation that we aren't building the required type of housing. So I thought maybe you could expand on that a little bit so I could understand it. When I look around and I see the amount of housing that we've been building for vulnerable populations, it's significant, in actually the hundreds of suites or units, while at the same time, non-market housing, we haven't built a single thing, which to me, I've said in this room that that's going to be the next thing that I'll support. I won't support any more of what we've been doing. We've been focusing on one thing and it just keeps getting worse. We need to deal with non-market housing. So, yeah, I was hoping you could expand on what you were saying there, Stephanie.
Yeah, I think there's a few typologies of housing that we're just not getting right. And when I say we, provincially, nationally, and not just we in this room. One is something that I refer to as complex care housing. I know the province has announced some things about complex care, although I'm not sure we have the same ideas about what that is. But we're really missing a typology of housing for people with complex medical needs. And we're seeing this in a couple of ways. We're seeing this in seniors who are experiencing homelessness who really need to be in long-term care, but they're not suitable for the long-term care system because of significant mental health and substance use challenges that make them more challenging tenants and, a little bit more difficult to house in a type of facility that's not really historically been built for that type of person. So we're seeing it there, a bit of a gap in that kind of long-term care area. And then just that general complex care housing. So I'm sure if Christy were here, she'd be able to add to this, but there are a lot of people who get put forward for supportive housing who simply aren't able to be tenanted with a place like 580 Dogwood because their medical needs are too high. Supportive housing, you are required to be able to live it independently. It's not assisted living. And so if you have complex medical needs, which as we saw, a lot of these folks do, you might not even be eligible to be considered for supportive housing. And that is why I kind of focused in on that housing and healthcare really needs to be linked piece, because I think that's a big gap in what we're seeing personally.
Just probably everybody in this room knows, but if anyone ever did watch this recording, 580 Dogwood, when it was presented to council at the City of Campbell River in 2018, 2019, was supposed to be supportive. There's a commercial kitchen that's built in the facility, and there was to be no cooking equipment of any kind in the suites. But when they built the units, they chose to put in hot plates so that individuals in their own rooms could be cooking, which was not the intention. And it would probably have had less support from council if it had been presented honestly and we had known that they were going to put those in. It created a real significant workload on our first responders. The fire department was there. I can't remember for sure, but I think it was an average of every 8 days for a fire-related issue related to the hot plates that had been put in that we didn't know anything about. So really, they're not housing the people that they were selling us on. But at the same time, the province is slow to respond on these things. If you go into treatment right now and you come out of treatment, there is nowhere for you to go. 0 places for sober living. There's also $0 available, apparently, through Island Health or BC Housing. Although 2 weeks ago, our council met with the premier who disputed that and said there is a funding stream. We haven't been told what it is yet, but the city has been offering a piece of land on Willis Road for 4+ years to develop a treatment facility on half of the property and sober living facility on the other half. I know that Chief Ronnie Shakite and members of his council have approached the province and expressed their disappointment that we've been unable to develop the housing on that. As Saqualuton is now open as a treatment center, I think they have 10 or 12 people in as their first run. But when those people come out, there is nowhere for them to go. There's been an investment of over $10 million made in that treatment center but the province won't support an investment of $3 or $4 million to start having sober living housing for them to go into when they come out. So I think those are a couple of the housing types that have been missing. And I know that the City of Campbell River would really appreciate any lobbying from this committee that would support funding any of those projects.
Yeah, absolutely. Second stage housing is another huge gap. I also thought that BC Housing had no funding streams, but I am curious if they're starting to open that up. I did send some information to your senior staff a couple of weeks ago about a new announcement from BC Housing, and it is, I think it's somewhere in the Lower Mainland, and they did have some private funding for it as well, but it is a recovery house with second stage housing attached to it for men. And it was the first time I'd seen kind of a recovery-focused or second-stage housing coming out of BC Housing. So maybe this is something new and hopefully positive. So I forwarded that to Jeff Ford and Andy Gaylor and Al, so that they could look into it further and see if there was anything maybe from the city's point that they could lean into that. Second-stage housing is a huge concern, I would say.
Well, we've been told there's funding for second stage housing. It's when you say they can't use in that second stage housing that there is no more funding. There's a difference between they're supportive, but everything that they've said they have funding for is wet. Coming out of months of recovery to go into a unit where somebody's using drugs next door is a waste of time and money and dangerous.
Yeah, so this one that BC Housing announced is a 50 recovery beds open in Langley for men, and it offers a full year recovery program with second stage housing and in a family style substance-free setting.
Further questions?
I have a quick one. Thanks, Stephanie. I've loved to see the dialogue around the table today, too. It's been great. I just wanted to know where sobering beds fit in between sheltered and unsheltered, because I know we have 16 of those in our community.
Yeah, sorry. Sobering also is counted as a shelter. Even though the Sobering Assessment Center isn't a shelter, it is a medical service. You do have to be under the influence of drugs or alcohol to access that facility. But yes, we do count that in our shelter as well.
And was that full this year? Or nearly?
I don't know the answer to that off the top of my head. I'd have to look back.
Just chatting with the operator, it seems like those are quite well used.
They are, yeah, I would be surprised if it wasn't close to full. It's a well-utilized site.
Further questions? Well, I have a few of my own. So the first thing I wanted to ask about is that with the housing symposium, I didn't see First Nations mentioned in there. Is there a reason why not?
Nope, just an oversight.
Okay. Reason why I ask is that in Area D, I do believe that First Nations are quite interested in this problem. And, I would certainly like to see them at the table if we're talking about anything like that.
Absolutely, 100% agree. And would you, if you have contact information for anybody in particular, I would appreciate that.
Yeah.
Thank you.
Happy to share that. Next question that I wanted to talk about with supportive housing, to get back to Director Dahl. I have a handicapped son who has severe problems, and I understand quite well that even it's taken me 4 years just to teach him how to cook some simple things. So what I want to say with supportive housing is that these people that have, mental problems and those kinds of things, it is challenging, but there is a way to work through it. And it's very disappointing to see the province not being able to tackle that. They're supposed to be the experts, and they appear not to be. And I do know that with my own son, privately, his parents have been able to make more stride than any other place that we've taken him. And that, to me, is a real failure of the system. So that, I just wanted to mention that. You mentioned a $5,000 grant and aid. If anybody wishes at this table today to put a motion in, we could refer that back to the board, if that's the will of committee members. And I also wanted to talk about lobbying. I think that that's something that's very important, and I think that we would be able to get a fair amount of traction with our MLA. And again, it might be worthwhile for this committee to perhaps consider, a letter or something even more effective. I'm quite willing to take a trip to Victoria. It's a day's ride. So a few things for people to think about. Thank you.
Sorry, can I just ask for clarity on that? A letter regarding specifically something, or?
She is quite keen on medical issues. She's an addiction doctor, and I think that she could be extremely instrumental, especially, I believe that she is the critic at this point in time. So, why not leverage that?
Through the chair, thanks. And just wanted to also say that there's not always a great way through this format to share how Stephanie's presentation leans into some of the past conversations at this table. But I do see the Housing Symposium as an opportunity to bring developers together to talk about the non-market housing need in our community, First Nations that are looking at developing housing, and nonprofit operators who maybe need, a leg up in capacity, basically to hear the challenges from all sides. So I just wanted to share that is one of the major reasons I wanted Stephanie to come to the table and talk about the Housing Symposium today. I'm really hoping we can support with funding, and I would be happy to bring a staff report to the board for final decision making.
Further comments, questions? Seeing none, let's move on. Can I get a motion to adopt the previous minutes from September 10, 2025, meeting of the Community Health and Wellness Committee?
So moved.
Can I get a seconder?
Second.
Thank you. Business arising, does anybody have anything from business arising from previous minutes? Seeing none, let's get right into the reports. Can I get a motion to receive the Recovery Support Services report on the North Island? Can I get a motion, please?
I can move that.
And a seconder?
Second.
Thank you. And is somebody going to present the report? Thank you.
All right, so this arose from discussions around, our next steps as a committee and what we want to focus on. And I'll be the first to say I'm definitely not an expert in this topic, subject matter. So I've been leaning on some of my community connections that are in the mental health and substance use world. And firstly, I just wanted to put together some of the services that are currently offered in the North Island. There is a couple handfuls. They are well utilized. I'm not completely sure of their capacity at the current moment right now. But what I expect if I talk to them is that they are hosting many people that are needing access to these services. So I just put together this infographic. Sorry, it is quite small on the screen there. But my next step would be to reach out to all of these organizations individually and have a conversation about their capacity and what their opportunity is to grow. And I know we've talked already today about second stage housing. I'm wondering if there's appetite from any of these groups in that next stage. And yeah, I'm hoping we can have a conversation around what we see as a next step. I just wanted to bring something forward that shows what's currently out there.
Thank you, Chair, and thank you, Madison. Yeah, it's great to see a start on it. And I would certainly make a motion that we continue to gain information on all the organizations and bring that back to us. So after we receive the report, I'll make the motion.
Just wondering if that, when you're talking to other agencies, if you could also look at their referral paths, that would be helpful to know.
Further comments or questions? Sorry, I'm going to call the question on the report. Can I get a motion for that? Okay, so calling the question, all in favor? Thank you. Moving on. Can I get a motion to move item B, please?
I'll move that.
I'll second that.
We didn't hear the first part of the motion, though. That might be the microphone that's not working. Every once in a while, it comes unplugged. This one? Yeah. There we go.
Were you waiting for my motion?
That's correct.
Yeah, I'll make that motion. Is it this one here, that the
Yes,
social
item
planner
B.
assess the capacity of the outlined services and aim to learn the challenges in expanding residential services?
Thank you.
Second.
Thank you. Calling the question, all in favor? Any opposed? Seeing none, let's move on. So item 2, the Just Like Home Lodge, can I get a motion to receive this report, please? Oh, it's just a presentation. Who's going to do the presentation on it?
Thank you. All right, this is just a bit of an update of what we've been working on around the Just Like Home Lodge and the healthcare professionals housing that's going to be adjacent. So I know this isn't new for most of you, and it's a quite short presentation. I was hoping we'd have a few more people around the table today that it would be new for. But just know that I am working on this in the background, and it does lean into our priorities of housing and supporting healthcare, obviously. So this is our brand new logo, Just Like Home Lodge. This might be the first time you've seen it, so yeah. And then this is a mock-up of the front of the lodge. The workforce housing is just on the top floor. And the reason why this has been put together, obviously stemming from need, but has come a long way over the last few years, is for people to receive care faster. They don't have to put off their appointments. They can come into the community when they need to access their appointments and have a place to stay. To bond with others, does have a significant communal space and times where people can visit you in the space and a place for you to use it if you are just a day user. Reducing travel needs and costs. So we know people from the North Island, the islands, the West Coast, they're all traveling quite significantly to access medical care, specialist, dental care. Everyone accessing those services will have access to the Just Like Home Lodge. It'll be referral based, so there'll be some vetting in place on who gets to use the service and some triage as well, because we know that there are, more emergent medical needs than maybe, I don't know, I'm not the triage specialist, but there will be a triage system so that we're making sure that the most appropriate stays are happening when they need to. And obviously, we're allowing loved ones to stay with you. So there's no need to find a hotel at a high cost. They can stay in the lodge, whether you're in the hospital or you're also staying in the lodge and accessing day treatment. So these are just a map of all the communities that the Campbell River Hospital serves. It's quite a large area, obviously includes areas outside of the Strathcona region, into Mount Waddington, onto the mainland. This just overviews the communities. So there's 32 communities on the North Island and the coast that are served by the hospital. This amounts to about 57,000 residents. And the hospital is the first point of referral for pretty much any of your needs, illness, emergent needs, even, if there is opportunities to move into recovery, the hospital can provide referrals for that. So patients that don't seek medical treatment due to economic crises, maybe due to travel or needing to stay in Campbell River, this is hopefully providing a leg up for those people that need the access to care. This is some of the statistics around who we expect to stay in the lodge and who's accessing the hospital. So the colors, sorry, it's probably a little bit difficult to see, but obviously it's not all overnight stays. So when you're driving from Port Hardy to Campbell River, maybe you are accessing emergency care, maybe you're coming for a medical imaging appointment. It's a very long journey back to Cayuga, back to Port McNeill, especially depending on the season. So the Just Like Home Lodge will make an impact on those and hopefully reduce the amount of travel that people need to take back and forth. This is just a mock-up of what the lodge is intended to look like. This is the communal space on the right side. There is a day use space. There's a place to prepare meals with your family. And then there's a number of different sized units depending on family size, because we know, multi-generational families are traveling together when accessing care, or if a loved one's in the hospital, you never know who's going to want to come visit. There's laundry, there are accessible showers, there's a lot of different things. RV parking as well if people need to stay that have their own place to sleep. And then this is kind of a new venture for the SRD, workforce housing for healthcare professionals specifically. I heard through the grapevine that it was really well received at UBCM, that this is something the SRD is putting forward. There'll be 20 units, bachelor 1-bed and 2-bedroom units for doctors, locums, nurses who are traveling, as well as any of the allied professionals, your x-ray techs. We're still deciding on what that eligibility criteria looks like, but mostly everyone who works in a hospital or in the medical industry will have the opportunity to apply to live here. And then we just have this video that was made when they were fundraising for the lodge, and I'm just going to show it. It's 4 minutes.
He sat in a chair long enough to get his hair cut and called himself handsome, and he was. And he died a couple of days later. Just in my arms. I mean, it is part of living in the North Island that you take those chances, you have those challenges. Every time you leave town for a medical situation. The worst thing is having to be in an awful situation where somebody that you love is in a critical state, and your mind is all over the place, and then you have to deal with logistical things, like where are you going to stay, what are you going to eat, what money are you going to use? I mean, we weren't exactly rolling in the dough, and the hotel bill started racking up. There were no other options. David was about to start salmon fishing that next summer, and all these things go tumbling through your head, but initially it's just panic. Panic takes over. And many trips back and forth to the hospital, chemo had to start. And so the journeys began of cancer treatments and tests, back and forth to Campbell River most of the time. Any hotel will tell you that you can't check in till 3 o'clock. You have to check out by 11. So if you're looking at one night, well, it depends when your procedure is at the hospital. And sometimes to save a little bit of money, you take the chance of driving all the way back here. And in the wintertime, that can be so dangerous. I remember one particular instance, and it was a sort of borderline winter. It was in the shoulder season, but you still get those snowfalls when you least expect it. We just couldn't afford any more hotels that week. Anyway, we got past Sayward, and we hit a snowstorm on the way home that day. It was so bad, the snow came down so fast, and it got dark. I've never been so scared in all my life, and I turned to David and I said, we are never ever going to go through this again. I don't care how much money it cost us. We are never going to leave that hotel or leave that hospital and drive home again when it's this late at this time of the year. There were times when David was hospitalized that I had to just leave him there because I couldn't afford to stay. So I had to drive back to Port McNeill, wait a few days until I could come back again for another couple of days. On his birthday, what would have been his birthday this last February 15th, I got a letter from Kelsey saying what you guys were doing to create a place for North Island people to stay at while they were getting treatment at Campbell River Hospital. It would have meant a lot to him. Another place to kind of call home, a temporary home, instead of a hotel room. There's a lot of people that are going to be happy.
Thanks, Betty. Yeah, so that's just the rationale behind the project. And if you have any questions, I'm happy to take some. There's a lot of work going on in the background to develop the operational model for this. I certainly don't have all the answers yet, but there's a small team working on it. So, yeah.
So questions? Go ahead.
I don't have any questions, but I'm going to say that Kelsey and Stacy run the Campbell River Hospital Foundation and do a great job. My wife spent 25 years at VHA and worked at the Campbell River Hospital for most of them, a little bit at the end at the Lodge, Ucalta. So we've been supporting their fundraisers for quite a few years. Gotten to know Stacy mostly at the golf tournament, and then got to watch this video a couple years ago. And we're fortunate that I think Dave is on their board. I'm not sure what his position is there or involvement, but Dave overheard Councillor Lanyon and I talking about workplace housing for the hospital and different locations for it and how long it would take to get it done. And a developer that we could work with that was willing to do it with us. And Dave was involved with trying to get this to come quicker. Raising that amount of funds takes a lot of time. I don't remember where they ended up. Somewhere over $1 million anyways, maybe 2 million. still quite a ways from what it was going to cost. So Dave said, I have an idea of how we could get that and this done quicker. We already have access to a piece of land that's zoned for this use. It's serviced with water, sewer, and hydro. So if we added workplace housing to the home away from home and got the developer that had agreed to work with us on developing that, maybe we could get this done quicker. So we got together with the developer, talked about this and how it could work, and he volunteered to take it on, build everything at his cost, saving a significant amount of money and doing it with our new housing service. So personally, I'd like to thank Dave Leach for forward thinking, out of the box thinking, and eavesdropping, and the Mailman family for being willing to do this to support their community. They support the community in so many ways, and they get a lot of credit, but I don't think they get the amount of credit that they deserve. So it'll be great to see this come to help people like David and Hilty, because it's a pretty hard video to watch. Unfortunately, there's more than one story like that. So that's all I wanted to say.
Further comments?
I might have missed it. What's the anticipated opening date?
The build should be done by fall 2026. Opening date to follow.
Any other comments? No? I do have a few. First of all, I agree with what Director Dahl said. This is quite a good project. It is utilizing the Strathcona Regional Housing Service, which did take some doing to get that one put together. We had a few directors that tried to roadblock that. And what's amazing with this project is through the power of this regional service, it is costing the Strathcona regional taxpayers peanuts. I believe it works out to be $11 per house per year as this project is moving forward. I think that's what the number was. The comments that I heard the day of the presentation were quite positive. There was doctors that came up and said, this isn't going to be just used by the SRD, it's going to be used by the entire North Island. So I think that's quite significant how, a little bit, and look what we can do with that. So those are my comments, and thank you. So moving on, I would like to, I don't believe we need a motion for anything there, no? So moving on to item number 3, we do have a new member, so I'll turn it over to who's going to talk on that. Thank you.
Sure. Hi, everyone. So my name is Angela Lane. I'm from the Immigrant Welcome Center. I believe we had someone who was representing our organization a while ago, but due to some staffing changes, we just fell off for a little while. So I'm back to revisit this and share our insights and learn some things, I hope, about how we can better support our newcomer clients. Am I close enough? Is my voice coming through? I feel like I'm not leaning far forward enough. Or can I? Okay, I'll do that. All right, so just a quick overview, if we can go down a little bit, just about our organization in general. So we work in Campbell River, the Comox Valley, including Powell River, and in northern Vancouver Island. So this discussion about the challenges facing newcomers or just individuals living in Port Hardy and Port McNeill, that's very relevant to the services we provide. We also forge partnerships with organizations and people in the region. So that's part of my role. I work in settlement and I work in community outreach. So part of My role in the organization is to reach out to other service providers in those communities. And as settlement service providers, so part of my job is indirect and part of it is direct services. Part of it is knowing what's available in the community so that we can best refer our clients to the services that can help them. We know as an organization that we can't be everything to everyone, but if we're familiar with the community, if we know about other service providers, we can better direct our clients to get the help that they need to settle properly. So our vision is to embrace diversity and inclusivity in the region. So we do this through those direct services. We do it through forging partnerships with other organizations. And we also have our Welcoming Communities Coalition, which some of you may be familiar with, which is our local immigration partnership with Christine Salzman. We are a nonprofit, so we do get our funding from the BC provincial government, but the majority of our funding comes from the federal government. So we're a nonprofit, but we answer to them for our funding. Can we go down? Some services that we provide, and you'll see some kind of overlap between what we've heard today around housing and also the goal of this committee of health and wellness. So we do help them with applications, so about getting settled here in general, income tax, referrals to other organizations. The third point, though, about housing, healthcare, human rights, that's a huge one. So this is a lot of what we see coming in. Newcomers do have fewer supports here than many Canadians do, fewer connections, there's language barriers, there's all these additional challenges to accessing resources. So employment, so we are involved with other organizations about employment, but yeah, we're providing community resources. We help them with the Canadian citizenship, so that progression through maybe a work permit to PR to citizenship. We also provide language support, so language classes, but also settlement services in a range of languages on staff. I speak French and Turkish, so I could do that. And we have lots of other settlement service providers who provide other language supports. Can we go down, please? I don't have a lot of recent data. We've done a couple of needs assessments over time, and that is available on our website. We did one in 2020 through our Welcoming Communities Coalition, again, our LIP, and the most recent one was in 2023. I tried to just look through it because it was a lot of information. We had focus groups from a couple of different groups in the community, including just regular citizens as well as newcomer individuals, and talk to them a little bit about their health and wellness needs, but also other needs in the community. So I just pulled some information about specifically health and wellness because that's the goal of this committee. So if we go down a little bit, I'll just go through a few of them. So healthcare, transportation, and childcare were huge. And there is kind of links between that. As we saw with North Island, if you don't have transportation to get to a hospital and it's far away, then you're going to have problems accessing healthcare. So a lot of these are obviously intertwined. So they have limited resources. A lot of newcomers come in. They might not have family members here. They might not know the services. Things might be very different in their home countries. So this is also a challenge. Interpretation, if they don't have the language to access services. I've lived in other countries, and going to the doctor was terrifying when you don't have those language skills. So we do have interpretation services in-house, but I know, I believe that Island Health also has those services available. Some hospitals can provide that, which is great because, yeah, it's terrifying. So employment is another issue, obviously, although that doesn't relate to this one so much. But as far as healthcare, I know I was on another committee meeting recently for healthcare worker attraction and retention. For newcomers, getting their equivalencies and having the language skills to be able to practice medicine in this country is a challenge, and that's something we see quite a bit. So as far as, you know, the impacts on the communities, if we're bringing in people who are trained professionals and they can't work in that profession, we're not really making any movement forward on improving our community's access to healthcare when we're bringing in people who can't practice. So that's a huge barrier that was identified in this research. A little bit down. Yeah, a little bit more about cultural adaptation trauma. So we do have, they were low quality images, so I didn't include them here, but a lot of newcomers reported not accessing mental health services. So I'm not exactly sure why. If there's a barrier, probably language is a huge barrier, but also just cultural differences and what that means to access trauma-based resources or mental health care. So more than regular just going to the hospital or going to a doctor, there are very few newcomers access mental health services. So our goal in being here would be to learn a bit more about that and what services are available and how we can improve that. Yeah, and as with the rest of the population, there were described issues, and this was 2023, so I don't know if it's gotten better or worse, but lack of available healthcare providers. So I've been here for a year, I'm still on a list through Health Connect, I don't have a family doctor. So for our newcomer clients who may be older or may have more healthcare issues and need to go to the doctor more often, of having to use emergency rooms or going to the primary care clinic, it provides additional challenges. So my goals in coming here, yeah, you can go down a little bit. My goal in being here is just to learn more about the community as a whole, since I'm quite new to this community as well. I've been here a year. So like everyone's doing amazing work in this community. So continuing this outreach work and learning how best we can support our clients is my goal in being here, and I'm very happy to be invited. So thank you very much. That needs assessment report is linked there and through our website. I appreciate it.
Thank you for that. Any questions? Seeing none, let's move on to the round table, and we'll start with Stephanie.
Nothing to add from me, although I'm just wondering if the committee did want to consider putting a motion forward, as you had suggested, for the a letter to the MLA related to some of the gaps in housing. I don't know if that would be a good time for that. This would be a good time for that.
We can think on our feet quickly and put together a quick motion, if that is the desire.
I'll make a motion that the Strathcona Health and Wellness Committee pen a letter to the MLA concerning challenges in the non-market housing sector.
And could I suggest just one more piece to that? And the challenges with supportive housing.
Sure.
Can I get a seconder for that?
I'll second that.
Okay. Calling the question, all in favor? Any opposed? Seeing none, that carries. Let's move on. Did you have anything else to add? No? Okay. How about yourself there, Director Dahl?
I said enough already. Welcome, Angela.
Well, thank you for all of the comments. That was the most that I've heard from you in a while. Moving over to Director Kerr.
No, I don't have any comments today, but great to see everybody out.
Okay. And again, I'm still learning names, so let's just move forward. I can't see your...
Dawn.
Dawn?
Dawn
Thank
Hamilton
you.
with the Division of Family Practice. Welcome, Angela. I don't really have anything to add. I think I didn't speak up when we were talking about Just Like Home, but I'm very excited about that particular project, as I've talked to Stacy and Madison Onako about. Just looking at, how, in particular, the workforce housing piece, because obviously, we work with all the family physicians in Campbell River, and there is clearly a crisis all across, not just in Campbell River, but that's our focus and district. And so how can we, ensure that we have access to allowing, say, locums or physicians who are coming here to the community who, don't have housing yet. They haven't bought a house and they need somewhere to stay, and just what that looks like. So excited to work with your team, your operational model team. So thank you.
Okay. Go ahead.
I just also wanted to circle back. Stephanie did have an ask in her delegation, which we didn't make a motion on. I'm wondering, I just want to bring it back to the table. If this is to go to the board, I would need a motion to bring it to the board for the housing symposium. funding.
Okay.
I'll just also add that this funding, we've received funding from Island Health. It's called a Community Wellness Grant. It's very broad in what it funds. It was actually received in 2017, and we have some residual funding from that. So it's not coming from the grant and aid budget. It's coming from the Health Network's Island Health Wellness Grant.
And just quick question, is there enough in the fund to do the $5,000? Okay. Why don't you just put a motion and we'll call the question on it?
I'm actually not a voting member, so I can't make a motion, sorry.
I'll make the motion.
Okay. Can I get a seconder on that, please?
I'll second that.
Thank you. All in favor? Any opposed? Okay. Okay, seeing none, the motion carries. Moving on with the round table, we'll go to Angela.
Sure. What is the purpose of the roundtable discussion? Just
To
anything that
bring
came up?
anything forward that you think that we should be working on.
No. Okay, thank you.
There's nothing off the table, so I mean, if you have an idea, bring it forward. The only thing that I would like to add to the roundtable discussion is going back to the recovery support services for the North Island. The report mentioned that there's significant service gaps. Can we get a little bit more information as to what exactly are the gaps, please? And I think that would be quite helpful. Other than that, that's all I have. Anybody else? Let's get a motion to terminate, please. Seconder? All in favor? Any opposed? Seeing none? The meeting is terminated. Thank you.